This is an easy way to map the inferior alveolar canal. First, make sure your license has been selected and that we're in diagnosis. In the panorama window, double-click on the patient's mental foramen. In the cross-sectional view, you should be able to see the exit of the mental foramen here as well as the base of that anterior loop. If you can't see it, move your cursor off center, left-click and hold it down and move it up and down until you can see the path between the exit and the base. Once there, double-click on the base of the anterior loop. Now we're ready to map. Select nerve on the right-hand side and let's select the right side. Make sure you click on nerve point and click on the exit of the mental foramen and double-click at the base. Those two points have been connected and you can see that here in the 3D volume. Now, as you know, that nerve can move anterior as much as 5 millimeters or so. And you may be able to see it here in the tangential view. To be able to see it, you may want to turn off the crosshairs. Left click, go up and down in the tangential view, off center in the window. Then you can see how far it moves forward. Right there. I'm going to double click there. Then I'm going to move to NPR radiology. This window will allow me to see the whole canal in one slice. Now notice, we're working on the patient's right-hand side. When we move the slider, let's keep it within these 2 points. If we were working on the patient's left-hand side, we would keep it between these 2 points. To make navigation easy, tilt the chin up. This will allow us to see the slice and how parallel we are with the bottom of the mandible. Left click and hold the slider and move it to the right until you can see the canal. There it is. Once we see the full canal, enlarge this window. Then proceed to double click. If you need to left click and move it lingual buccal, you can do so here. Once you're done, select diagnosis and it locks in all the points. Then go back to the panorama screen. And you're done.